Welcome everybody to our ADN6 community project. Our presentation is on breast cancer of San Joaquin County. Did you know a woman has a 1 in 8 chance of developing breast cancer in her lifetime? Breast cancer is a type of cancer that starts in the breast. It can start in one or both breasts. Cancer starts when cells begin to grow out of control. Breast cancer occurs almost entirely in women, but men can get breast cancer also. Breast cancer can spread outside the breast through blood and lymph vessels. Some statistics we wanted to share for San Joaquin County for females in 2015 to 2019. 116.5 people in every 100,000 people develop breast cancer, compared to the state California, 123.1, and the rest of the U.S. at 128.1.
The most common symptom of breast cancer is a new lump or mass, although most breast lumps are not cancer. A painless, hard mass that has irregular edges is more likely to be cancer. But breast cancers can be also soft, round, tender, or even painful. Other possible symptoms of breast cancer include swelling of all or part of a breast, even if no lump is felt, skin dimpling, sometimes looking like an orange peel, breast or nipple pain, nipple retraction or turning inward, nipple or breast skin that is red, dry, flaking, or thickened, nipple discharge other than breast milk, swollen lymph nodes under the arm or near the collarbone. Sometimes this can be a sign of breast cancer spread even before the original tumor in the breast is large enough to be felt. Many of these symptoms can also be caused by benign or non-cancerous breast conditions. Still, it's important to have any new breast mass, lump, or other change checked by an experienced healthcare professional so the cause can be found and treated if needed. Remember that knowing what to look for does not take the place of having regular screening for breast cancer. A mammogram is an x ray of the breast. For many women, mammograms are the best way to find breast cancers early, when it's easier to treat and before it is big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. At this time, a mammogram is the best way to find breast cancer for most women of screening age. A breast MRI uses magnets and radio waves to take pictures of the breast. Breast MRI is used along with mammograms to screen women who are at high risk for getting breast cancer. Because breast MRIs may appear abnormal even when there is no cancer, they are not used for women at average risk. A clinical breast exam is an examination of a doctor or nurse who uses his or her hands to feel for lumps or other changes. Breast self awareness, or being familiar with how your breasts look and feel, can help you notice symptoms such as lumps, pain, or changes in size that may be of concern. These include changes found during a breast self exam. You should report any changes that you notice to your doctor or healthcare provider.
Some of the risk factors that cannot be changed are getting older. The risk for breast cancer increases with age, and it is mostly diagnosed after the age of 50. Genetic mutation BRCA1, BRCA2 are inherited mutations in the genes. People with this mutation are at higher risk for breast cancer and ovarian cancer. The reproductive history, longer exposure to hormones, starting menstrual periods before 12 or starting menopause after 55 expose women to hormones longer, raising their risk. Dense breast tissue also have more connective tissue than fatty tissue, causing higher chance for breast cancer. Previous history of breast cancer or non-cancerous breast disease, family history of breast or ovarian cancer, and previous treatment using radiation therapy to the breast before the age of 30 increases the risk for breast cancer. Also, exposure to drugs diethylstilbestrol (DES). DES was given to pregnant women between the years 1940 to 1971 to prevent miscarriage, and DES is a risk factor for breast cancer. Some risk factors that can be changed or can be modified is lack of physical exercise, being overweight, obesity after menopause, taking hormones, the reproductive history, alcohol use, or smoking.
Breast cancer exacerbation refers to the worsening of the cancer or the development of new cancer cell. The extent and location of the exacerbations can vary depending on the individual and the type and stage of breast cancer. Exacerbations of breast cancer can include metastasis. Cancer can spread to the other part of the body, such as the bone, liver, lungs, or brain. Metastatic breast cancer is more difficult to treat and can be life threatening. Tumor growth. Breast cancer can grow and invade nearby tissues and organs, leading to pain, discomfort, and other symptoms. Recurrence. Breast cancer can recur, meaning it could come back after initial treatments. 3. Resistant to treatments. Breast cancer can become resistant to certain treatment, making them less effective. Local recurrence. This occurs when the breast cancer returns in the same breast after initial treatments. Regional recurrence. This occurs when the breast cancer spreads to nearby lymph nodes, such as those in the armpit. Distant recurrence. This occurs when the breast cancer spreads to the other parts of the body, such as bone, liver, lungs, or brain. Development of new cancers. Exacerbations can include the development of a new breast cancer in same opposite breast. The likelihood of exacerbations and the location of the recurrence can depend on various factors, such as the stage and type of breast cancer, the treatment received, and the other individual factors. It is important for individuals with breast cancer to undergo regular follow-up appointment and imaging tests to monitor for any signs of exacerbation. Treatment option for exacerbation of breast cancer depends on the stage and extent of the cancer and may include surgery, chemotherapy, radiation therapy, hormone therapy, target therapy, or a combination of these therapy treatments.
Nursing management monitor for adverse effects of radiation therapy such as fatigue, sore throat, dry cough, nausea, and anorexia. Also monitor for adverse effects of chemotherapy, bone marrow suppression, nausea and vomiting, weight gain or loss, fatigue, anxiety, and depression. Realize that a diagnosis of breast cancer is a devastating emotional shock to the woman. Provide psychological support to the patient throughout diagnostic and treatment process. Involve the patient in planning and treatment. Describe surgical procedure to alleviate fear. Prepare the patient for the effects of chemotherapy and plan ahead for alopecia and fatigue. Administer antiemetics prophylactically as directed for patients receiving chemotherapy. Administer IV fluids and hyperelimination as indicated. Help patient identify and use support persons or family or community. Suggest to patient the psychological interventions may be necessary for anxiety, depression, or sexual problems. Also, teach all women the recommended cancer screening procedures.
Treatments for breast cancer depends on the stage of cancer. It may consist of chemotherapy, radiation, and surgery. Some of the breast cancer support groups available at San Joaquin County are St. Joseph's Medical Center Breast Cancer Support Group. For more information, you can call Cancer Navigator at 844-359-1076. Also, American Cancer Society is available. You can go check out their website at www.cancer.org, or you can also check out Susan G. Komen Breast Cancer Helpline at 1-877-GO-COMMON.